Hello, everyone, and welcome back to the Socially Desi Show, the podcast that motivates you to live, create, and inspire. If this is your first time here, welcome. On our show, we discuss tips and strategies with our guest speakers on how to tackle problems related to personal growth, mental health, relationships, business and entrepreneurship, and health and fitness. So hit that subscribe button and go check out our website at sociallydesi.com for more of such content. Today, I'm joined by the group CEO of Kim's Healthcare Group, Dr. Sherif Sahadulla. He's a highly skilled physician with over 20 years of experience in clinical medicine and hospital operations. Dr. Sherif is well regarded as a clinician leader, earning numerous accolades for his quality and patient centered care. Hello, Dr. Sherif. Welcome to the show.
Thank you, and thank you for having me on the show. It's a pleasure to be here.
The pleasure is all mine, Dr. Sherif. Thank you so much for doing this on the Socially Desi Show, especially during the times, that we have seen recently how the world has, gone from bad to worse, and especially in India where things are not going that great. I think it's a right time for this kind of an episode where we can talk about how, as general public, as people, as cosmopolitans, we can take care of our health during the whole pandemic. So, Dr. Sherif, before we begin and talk about all these things in the episode, why don't you tell our audience a bit about your professional journey so far?
Okay, great. So first and foremost, even though I am a group CEO of a international healthcare organization, I'm a physician first and foremost, and I spent most of my initial years just doing clinical medicine. I had done my med school and my postgraduate training in the U.S., and I was practicing in the U.S., and I came into healthcare management quite by accident. It was serendipitous, so to speak. I was put in a position, and then I just went forth, and it was always been a balance of clinical medicine as well as healthcare management. I was working for a healthcare management company. We managed hospitals, emergency departments, and other services for hospitals, and I spent a number of years doing that. And primarily in the Boston area. And about 5 years ago, after 26, 27 years in the U.S., I moved to the Middle East. I'm presently in Bahrain. I joined Kim's Health as the Chief Medical Officer for the group and an Executive Director for the group, and transitioned into CEO of the Middle East operations, and now presently Group CEO for the organization. We are presently located in 6 countries, so India plus 5 other Middle East countries.
Wonderful. And was this, switch from living in the US for 26 years, was the switch a planned one, or it just happened for you to move to Bahrain?
Yeah, my family had been asking me that question for quite some time. My father is one of the founders of the Kim's Health organization, and although he's never pushed me to come back, that question was always out there, and we finally got to a point where I was having a thriving career in the U.S. and I probably would have continued to do so, but then I would have missed on an opportunity that perhaps is a once in a lifetime opportunity to lead a healthcare organization, and at the same time to be able to work with my father. So because of those things, we decided to take a leap of faith, so to speak, and I moved here with my family. I think initially it was a bit of a challenge, an adjustment for both my wife and myself. I had lived in the Middle East years ago as a child because my parents lived in the Middle East, and so I had exposure, but it was a new experience for my wife. And obviously my kids. What I found is my children adjusted far quicker than I did. But
Okay.
and kids are very adaptable that way, and
Yeah.
they made friends and they got on with school and their activities. It took me and my wife probably a little bit longer. Now we're settled into life here. Work keeps us both busy,
Hmm.
and so things are much better than the day I arrived when I questioned what exactly I had done.
Yeah.
But we're in a much happier place now.
Yes. And talking about that, Doctor, you joined Kim's Healthcare Group in 2019, right? A year before.
2015.
Oh,
2015.
15. Okay. But
Yeah,
you were, okay. So you were appointed as the group CEO in 2019, was it?
correct. Yes.
Okay, okay. So, taking that leadership role in 2019 and then just the next year, the world was hit by this pandemic, right? So, you must have faced a lot of challenges being a leader of the group of hospitals. I would, like you to share a few of these challenges that you saw with respect to the healthcare management as well as with the patients and general public, which were, coming in for medical care.
Thanks. So it was challenging. I had always been involved in the India business, even when I was CEO for the Middle East. I was still involved and a board member for the India business. But as I transitioned into the role of group CEO, we were hit with this pandemic. Uh, Previously, I was traveling to India and visiting our facilities there probably twice a month. So this was one thing that was restricted, but I think we very quickly learned that a lot of things can be done over Zoom and
Yeah.
Meets and things like that. So we had to adapt to working remotely and making that effective.
Hmm.
And I think that is here to stay for in a certain way. But at the same time, I think we miss the social and even team building that occurs when we actually meet in person. We're always sort of at a distance when we're meeting on Zoom,
Yeah.
and so I think that there is some benefits because we're not wasting as much time traveling, but there's some downsides to it that are perhaps we didn't feel as much in the beginning, but are becoming more evident in not just healthcare management, but sort of any management as we go along. I like to meet with our healthcare providers, our physicians, and our nursing staff and allied health, just to understand their challenges. And while we do that on Zoom, it's just not the same. That personal connection you're not able to establish as much in Zoom.
True.
Um, from a business perspective, when I look at it, we were badly hit. I think healthcare overall was badly hit in the beginning, and people who are not in the healthcare industry are a little bit surprised about that. Well, it's a pandemic, it's a healthcare issue. Why wouldn't you be busy as a healthcare organization?
Mm.
But what we found is that one, because of lockdowns, people didn't come to the facilities. Two, because of fear, people didn't come to the facilities. People with chronic medical conditions put off seeing their doctor to a certain degree. And so, for
Yeah.
all of those reasons, the volume in our hospitals, dropped. So we were operating at about 50%, in some
Hmm.
places 70% drop in what we were seeing before.
Okay.
In varying countries that hit us to varying degrees. And we're recovering from that. I think the Middle East recovered from that probably in the fall, September or so, and we started to see numbers, picking up for people
Hmm.
visiting healthcare. Um, in During that time, also we had to switch rapidly to being prepared to take COVID patients to our
Right.
facilities. And it was an interesting mindset. Initially, people also didn't come because we felt a necessity as a healthcare organization to be able to provide COVID care. So in all
Right.
of our inpatient facilities, we started doing that, and there were people who responded, why are you taking COVID patients? You're just going to scare away your regular patients.
Mm-hmm.
But as the number of COVID increased, people were thankful, thank you for taking COVID patients, because they realized that at some point in time, everyone is going to, or a large number of people are going to need services. And now, unfortunately, because the numbers have spiked again, more where we're having to allocate more and more beds to COVID. And so that does put a strain on the providers, the doctors, the
True.
nurses, all of our staff. It puts a strain on the system as a whole. And that's why, I implore everyone to continue to maintain those uh, the, the advice from our regulatory bodies, from our governments, from our health advisors about social distancing, mask wearing, vaccinations, because unless we do those things, we're not going to be able to overcome the current situation. So right now we're ramping up in terms of COVID and COVID care. But what we saw from last year to this year, I mentioned that last year there was a high fear factor, low number of cases. This year it's a high number of cases and low fear factor. So people continue as long as there's no lockdown as such, and that happens at various points of time. But people continue to come to the hospital now, as opposed to last year, to get their chronic care. They
Yeah.
continue to come for elective procedures. Perhaps not as much as before COVID, but people are coming back.
Yeah.
I think it's our responsibility as healthcare providers that we win the confidence back of our consumers, of our patients, because there's still a little fear factor out there, but we need
Yeah.
to be able to demonstrate that both COVID and non-COVID care can be provided with the appropriate safety measures that are taken, because we want people to come in for their chronic conditions, because if they don't come in for their chronic conditions, then they will end up in a worse state with one of their chronic conditions, and that will cause more strain on them and the healthcare system down the line.
True that, doctor. That's very true. And one thing that really changed, in 2021 as compared to 2020 was uh, in 2020, people didn't want to go to the hospital even though they had COVID, right? I think that at that time, the variant of COVID was a bit different. It was not attacking the lungs the way it is right now, right? But this year, uh, people, there was a quick outburst, and you saw that the number of cases they shot up in India, especially, and there was a lot. There were a lot of allegations in the medical system that why weren't we ready for this kind of a issue, or maybe why weren't there more beds or more ICUs or more ventilators. So in your thoughts, how do you think we could have prepared for this kind of an issue?
This unfortunately, this lack of preparedness, we've seen throughout the pandemic. Okay, in the beginning, well, this is a Chinese problem. This is not anywhere outside of China, and so we don't need to do anything to prepare.
Hmm.
Then okay, it's an Asian problem. It's only in Asia. Other parts of the world don't need to do anything to prepare. And as a result, we were all caught off guard. I mean, in all fairness, we probably didn't understand the disease,
Yeah.
the virulence of the disease, how easily transmittable the disease is now, even in the beginning, even and more so now with the new variants. So, we haven't seen anything like this in our lifetime. So again,
True.
it is hard to be prepared. There were probably steps that we could have done in terms of, restricting the flow of people. And certain countries have done a good job about that. For example, Australia, New Zealand, they've been able to control the disease to a large extent by controlling the flow of people in and out of the country.
Yeah.
In some ways, over the last 2-3 decades, we've become smaller, and everything is much more accessible, and we travel a lot. And so this is how the disease ends up spreading. So we could have been perhaps quicker that way. And with each wave of the disease, unfortunately, it's become a worse situation. And I think
Hmm.
being human, psychologically, we say, okay, it can't be worse than this. And what we've seen, historically, although we haven't had historically as much data or the significant impact, is often in a pandemic or epidemic, the second or third wave, if there is a third wave, tends to be worse. And so now in India, we're in this huge second wave,
Yeah.
and the only way is to burn out the disease. To burn out the disease needs a host. Okay, the hosts are
Yes.
humans,
Yeah.
and the only way to burn out the disease is to prevent transmission from person to person. And it's a balance, because when we do that, we it has an impact on our well-being as individuals. It has an impact on us financially when we're not able to continue life as normal. So I understand there has to be a little bit of a balance, but
Yeah.
if we're willing to be cautious, if we're willing to take those precautions, then we can do that balance. But if we're not willing to take those precautions, then that balance is not going to work, and we have to
True.
go to extreme measures. And that's what a lot of countries have had to do, is have much stricter lockdowns because people were not complying.
True, true, and you spoke a bit about the importance of holistic wellness also. In your talk right now, you said it's not just your physical health that you need to take care of. The mental, the financial, everything is part of your health, right? So, especially last couple of months, I've seen a lot of talks around holistic health. So I wanted to understand from you, what are the key aspects to holistic wellness?
Yeah, so I think when you look at holistic, we generally speak about our physical being, our mental health, our spiritual health, our social
Yeah.
health, and so these are all aspects of holistic health, and in a number of ways it has impacted us all. So, physically, I would say that in some cases, people have made the best of the situation when they were in home isolation, and bought a lot of exercise equipment and tried to get into a good physical health using their time effectively while they've been, working from home and having more time. On the other side of the spectrum, I've seen people who have become a little bit of a couch potato, and just sat around with the remote control of the TV, and gained weight. So it's the question is, which side of the spectrum are you on? So I would look at this, make the best of the situation. I mean, it's not going to change overnight.
Yeah.
You know, if you get the disease, you're going to be able to fight the disease better if you're in a better physical condition.
Mm-hmm.
So I think we all need to try to get physically stronger. And what often goes, under mentioned is that aspect of mental health, and it has definitely put a strain on all of us, mentally. Again, initially it was okay; it was isolation. Maybe we thought, it was going to happen for a couple of weeks and months, but as it grows longer and longer, it becomes challenging. That isolation becomes challenging. Um, Initially, we were productive from home, but we've seen varying fluctuations in that productivity in the workplace because it's a stressful situation, especially when the fear factor was high. Not only fear factor, perhaps paranoia. All those things have an impact on our mental health. I'll tell
Yeah.
you a just brief story. One of my closest friends, and he was my best man at my wedding. He's a doctor in New York. Uh, and last year, New York was it was in flames. I mean, in the U.S., New York was in the worst situation, and cases were rampant. The healthcare system was overwhelmed. The hospital that he worked in, they were uh, uh, changing administration
Mm-hmm.
into hospital rooms, and they were at 150% capacity. So he was burnt out by all of this, and he was overwhelmed by all of this. And he sent me a message which still brings tears to my eyes. He said, "You're my closest friend, and I just if anything happens to me, I know that my family will be well off financially, but I would ask you to look in on them from time to time." And it literally brought tears to my eyes, and it still does when I think about this and the subsequent conversations that we've had. So he was feeling the mental burden of the situation, and I was in a situation where it wasn't as bad, where I am. And so, as much as possible, I would reach out to him. I would talk to him, uh, counsel him, and for him, it was a break from the things that he was experiencing every hour. So I think
True.
it's important that we look at ways that we can support each other. Everyone is in a different situation. Humans are social beings. We don't thrive in social isolation. It's our nature to be social, and that has been curtailed in the present situation. So, I can't go and physically see him or be with him, but we've connected again over Zoom, just connected over the phone, and we've supported each other. And he's in a better place, and when I was down, he supported me. So I think these are some of the ways that we can support each other and stay mentally strong. I think that's very important that we stay mentally strong.
I agree with that, doctor, because especially during these times, if you have your friends, your family with you, you need that mental support. So it's not just about the physical health, it's also about being mentally sane. And especially, like you spoke about your friend's situation, I cannot even imagine the kind of stress he might be going through on a daily basis, where his hospital is running on a 150% capacity. And yes, I mean, New York, that whole area was really, really hit badly. I had a couple of friends living in Manhattan, and they were telling me that, like the things were not going good. And I cannot even imagine the kind of stress and things that he might be going through on a daily basis. So I really urge to everybody listening out there, please make sure that you connect with your loved ones regularly. connect with your friends, your family, and make sure that you support each other during these times, because like doctor even said, this is something that we need to really really take care of and inculcate a habit around this, right doctor? It's more important for us to start living a healthy lifestyle and make a routine, make a habit out of this.
Yeah, I think establishing a habit, establishing a routine is very important. So whether it's a matter of physical exercise, get into an exercise program. Now, a lot of exercise programs are available online. So that's one aspect of it. Get connected with your friends and family on a regular basis. We used to play online, quiz games with
Mm.
family members in India and in the U.S. and in the U.K. We'd all get together and do a quiz, general knowledge quiz thing online, and so that kind of keeps you connected, but keeps you entertained at the same time. Also spiritually, whether you're religious or not religious, there's things that we could do spiritually, either through prayer or meditation, so that we have that balance within ourselves, that inner peace that we always try to strive for. So make sure you make time for that. So people are not commuting as much; they have more time on their hand. Spend time with family, but make it constructive time, not just vegging in front of the TV. I think it's that engagement is important with other family members, even under the same roof, because we now that we're so dependent on computers, we just tend to spend the day on our computers, and sometimes even forget to engage with the person who's living with us. And so, have social activities, even if it's in your home or in your yard, with members of the family. I think the toughest time, to some extent, has been for kids. Children have really suffered with lack of social interaction, lack of going to school, and I think to some extent this has impacted their development. But kids are resilient, and once we overcome this, I'm sure they'll catch up very quickly in sort of some of those developmental aspects. But it's important to engage our children and keep them busy. Otherwise, they will just go into playing video games all day long. And
Yeah.
so there needs to be other activities for them. So fortunately, where we are, um, some of the sports activities are open. My kids go for soccer. My kids go for
Okay.
tennis. But they do, they're all musicians, and they do their music lessons
That's
online.
nice.
So they have their instruments at home. Their teachers are online, and so they're still able to engage. They even played in some concerts
Wow.
organized by our music school. Online. It was a completely virtual
Hmm.
concert. Different people, different kids performed. So these are, and then some of their tutors. I know they do a lot of online school, but even outside of school, we've got them some other sort of fun but educational classes to keep them engaged. So, yes, that's a little bit on a device. And I said, don't spend so much time on a device. But at the same time, at least this is constructive work on a device as opposed to, you know, things like Fortnite, which I'm trying to limit. But, all kids seem to have gravitated to this over the past year.
Yeah, I think the key word here is constructive. And, even when I speak to kids in our family, I keep telling them that, yes, these are the times that you can't really avoid a gadget, right? A mobile or an iPad or a laptop. But the things you do with that device really matters. So, I mean, yes, you should play games, but you should not really, be focusing only on games. Make use of that device, make use of the gadgets, because growing up we never had that kind of the access to these kind of technologies. So you have that access, so make the best out of it. I think these are some of the good things that you can take away from that. And I really like that you push your kids for physical activities and extracurricular activities, performing arts, musicians. So that's great. I mean, I love to sing as well. I play a bit of guitars. So I
That's
really
great.
like when
That's great. So I can hear my son. One's a guitarist, one's a pianist, and one's a drummer. And so hopefully at some point in time I can make them into and one sings. I mean, one of the pianists sings as well. So I'm hoping that
lovely.
at some point in time I can make them into a band, and that will allow me to retire. But we're probably a little a ways from that right now, but I do hear them jamming in their rooms, and so I'm always happy to hear that. I still do allow them, video game time, because in some cases that's the only way they get to interact with their friends. They get on video games with their friends from multiple
Yeah.
locations, and so some of that is necessary, but it's always good to have buckets and buckets of time where they're okay. This is your video game time, and this is okay. We're going to do physical activities here or other activities. So I think that's important. And again, establishing a routine for the kids. Now, my kids are fortunate because they go every other day to school, and we're hopeful that in the next month that the schools may open up full time here. But I know that that's not the case everywhere, and in a lot of places. In most places, kids are completely online. So
Yeah.
we need to try to enforce that balance for the kids. And it's hard for the parents, especially when parents are both working parents. But even when there's one parent who's at home, it's challenging for that one parent who's home to dedicate all their time to the kids, because when kids are young, my youngest had a real hard time adapting to the online schools, and so my wife, who was working from home, had to spend a lot of time with him. And so, it's a strain on her because she's not able to get her work done. It's
Hmm.
sometimes frustrating
Yeah.
for my son as well. So we need to try to get back to some form of new, normalcy. Now it's going to be a new normal, and we've heard that term used a lot, the new normal. But we need to get to that point. I think it's essential that we get to that point of what a new normal is. And part of that is getting the kids back to school. My wife jokes and she
True.
says that school was invented by a mother. Uh, so we're trying to,
That's true.
get to that point.
So true, so true. So, as closing thoughts, Dr. Sheriff, what would you like to say to everyone listening, our audience, parents, family, uh, the patients, the doctors, the medical staff? What would be your, closing thoughts on the whole situation right now?
I think I definitely need to do a shout out to all the healthcare providers, not only in our organization but around the world. Uh, we're here with you. We know your challenges. We know your sufferings, and we're here to support you in any way that we can. Everyone's been working at more than what they're capable of or what their capacity is, and it's put a strain on them. And I think that's why we as a society need to see how we can relieve that burden. We're not out of the woods yet, even with the vaccine. Um, and I don't think I mentioned this, but vaccination helps. Okay, and that's the only way we're going to overcome this. But just because you're vaccinated doesn't mean that you won't get the disease. You still It's still possible for you to get the disease. You may get a much milder form of the disease. It may be less likely that you will pass on the disease to someone else or to a loved one living with you. So that's why it's important to get vaccinated. But just because you're vaccinated doesn't mean that all rules of social isolation and masking, go out the window at that point in time. You still need to
True.
maintain those precautions. So we need to continue to stay safe, and we will at some point be able to get over this. But stay healthy as well. It's just not a matter of staying safe. Stay healthy while you're trying to stay safe, and that means mentally, that means physically, that means spiritually. And we have to all try to work together. This is a time that we as a society, we as a community, globally, we need to come together and see how we can help each other. And if we do those things, I think that we will be on our way.
Thank you so much, Dr. Sheriff. That was a wonderful and motivational, closing thoughts. And even we, in Socially Desi, we urge everybody and we tell them that vaccination is necessary. You should get vaccinated. I got my first jab last week. And I think, everybody should get vaccinated as soon as possible. I know we have some problems with the system where we are not getting slots. A lot of people are getting frustrated, but it will take some time. We are a big population. So at the end of the day, the idea is for everybody to get vaccinated. So please go register and get vaccinated. With that, Dr. Sharif, thank you so much for being on the Socially Desi show. You have been a wonderful guest today.
Thank you. It's a pleasure to be here. I hope that I can get my message across to a lot of people. Stay healthy, stay safe, and God bless.
So that wraps it up for today, folks. If you liked the episode, give it a big thumbs up, share it with your friends, and let's go viral. Remember, our weekly podcast features episodes on personal growth, mental health, relationships, business and entrepreneurship, and health and fitness. We would love to have Dr. Sharif on our show again in the future to talk about more on health and mental health. So if you haven't yet done so, hit that subscribe button and go check out our website at sociallydesi.com for more of such content. And as always, before I sign off, remember, life is black and white and everything in between.